Hi guys, so the second set of lower limbs that we're going to talk about is the proximal and distal tibiofibular joints, which I have here in the diagram. I have an interior and a posterior view. So the most important features of these joints is the fibula, which you can see is this smaller bone on the outside of the joint, and that's one of the important bones, and the tibia, which is the bone on the intersection of the joint, and also the medial condylite, which I cover because those are the areas of articulation, and also here where you can see the distal tibiofibular joint, and on this side you can see the fibular notch, which I use the blue colors to explain. So basically there are only two articulations that take place in the tibiofibular joint, is the proximal, which is superior, and the distal, which is inferior. So the proximal articulation basically takes place between the lateral condylite of the tibia and the head of the fibula. So this articulation takes place here at the bottom, which you can see the lateral condylite, and it basically takes place with the head of the fibula, while the distal, which is referred to as the inferior, takes place between the fibular notch of the tibia and the lower end of the fibula. So you see here the fibular notch, and it's like it takes place between the lower end right here of the tibia. So basically the tibia is the bone that receives the weight of the from the femur, and it transmits it to the foot, while the fibula, which is located lateral, as I showed you, it's lateral to the tibia, is a long bone with two expanded ends. So its superior end is the head, and its inferior end is the lateral malleolus, which is here in the top part, which you find the medial condylite. So I will demonstrate the movement that takes place in these joints later on. So basically I can explain the articulations in more detail. So on the inferior part of the lateral tibia condylite is a facet that articulates, which you see here. I colored it in on both diagrams, interior and posterior view, right here and right here, is from the superior tibiofibular joint, which is here. And then the end of the tibia is flat, and this is where it articulates with the talus of the foot. So you'll notice that the end of the tibia is like a flat surface and articulates with the foot at the bottom. And then the fibular notch on the lateral side of the distal tibia articulates to the fibula, forming the inferior tibiofibular joint. I know this is a little bit complicated, as it's also a little bit complicated for me, but I'm trying to explain it as best as